So today we are discussing the brain death. As usual, we start with a case history. A 25-year-old male motorbike rider was brought to intensive care unit following a head-on collision with the car while traveling on a motorway. On arrival, he was found to have blood oozing out of the external auditory meatus and nose nostrils. Neurological assessment revealed the Glasgow Coma scale of 2 plus he was intubated, so 2T. Pupil were equal 3 mm bilaterally but not reacting to light. Family and colleagues questioned whether he was brain dead or not. So, the step 1 is to establish if there is an underlying cause for the patient to be brain dead. Is there is a cause for the patient to be brain dead? So, we have to look for potential cause of the brain dysfunction. No obvious cause, or if there is any doubt about the cause, be cautious in diagnosing the brain death. Make sure there is no confounders that mimic brain death. So, look for the confounders before proceeding for brain death verification. These are confounders like severe hypothermia, core temperature less than 32 degrees centigrade, severe hypotension, systolic blood pressure less than 100 millimeter of mercury, drugs which include alcohol, poisoning, recent use of sedatives or neuromuscular blocking agents, certain medical conditions like severe electrolyte abnormalities, hypoglycemia and acid-base abnormalities. So, coming to the step 3, we have to identify the brain death by completing neurological examination. This consists of 3 essential steps: documentation of coma, documentation of absence of brainstem reflexes, and documentation of apnea, that what we call as apnea test. Absence of motor response to the standardized painful stimuli could be documented as the coma. Beware of the local spinal reflex causing spontaneous or stimulus related motor movements. Documentation of the absence of the brain reflex. It starts with the brainstem reflexes are lost in the rostral to caudal direction. Reflexes in medulla oblongata are the last to cease. Tests documented are absent pupillary reflex, they check the optic and oculomotor nerves. Absent oculocephalic movements, that is what we call as Doyle's eye reflex, they check the vestibular part of vestibulocochlear and oculomotor nerve and trochlear and abducent nerves. Absent oculovestibular reflex, what we call as a cold caloric test, they basically check the vestibular part of the vestibulocochlear and oculomotor, trochlear and abducent nerves.